Hi, my name is Sarah Johnson, and today I will be presenting on childhood diseases and conditions affecting fertility. So, when it comes to infant mortality, just a couple quick facts. The United States aren't always number one. According to research done by the CIA, the United States ranked 169 out of 225 in 2016 for infant mortality, with 5.8 deaths of children per 1,000 live births. In this case, it's a good thing to be toward the bottom of the list. Monaco, a Mediterranean city-state, is the healthiest sovereign state. It ranked 225 of 225. The U.S. is only 55 places behind. Not too shabby, I suppose. Certainly not every illness that a child encounters will be fatal. Still, prevention through vaccines, knowledge about what is and is not contagious, and communication with healthcare providers can provide ease of discomfort and stop illnesses from becoming worse and prevent the spread. This eases concerns for family members, schoolmates, and caregivers. While Chapter 9 focuses specifically on prenatal and postnatal care, many other medical conditions impact the health of unborn children and prospective parents. Among them are common infections, certain cancers, genetic disorders, and sexually transmitted diseases. During the next few minutes, we will explore a small amount of diseases and conditions that impact neonates and children, and we'll also explore conditions that impact fertility. Hair, skin, and nails. Oh my. The integumentary system is discussed in Chapter 4 of the course text. It includes the skin, hair, and nails. A common skin infection among babies and toddlers is oral thrush. The medical term for oral thrush is oral candidiasis. The term is derived from Latin. Oral means pertaining to the mouth, candid means white, diasis means condition. Oral candidiasis is known as an oral yeast infection caused by the fungus Candidiasis albicans. It is characterized by white patches that appear on the tongue and the skin near the mouth of the child. It may also appear on the breast of nursing mothers. Along with white patches, the fungal infection causes itchiness and fussiness in the young child. A general practitioner or pediatrician can examine the affected area and determine the diagnosis by swabbing the child's mouth and having it sent to the lab. The doctor will prescribe a liquid antifungal medication for the baby to drink while offering an antifungal cream for the mother's breast if she's nursing. In order to prevent continued exposure, any bottles that the baby was using should be either thrown out or thoroughly washed. Childhood cancers, big battles fought by small soldiers. So Chapter 10 discusses blood as well as the cardiovascular, immune, and lymphatic systems. Lymphomas are cancers that originate in lymph nodes. While many of them can be treated, lymphomas spread rapidly, often impacting vital organs such as the spleen, lungs, and even the bones. Lymphomas are especially dangerous because they attack the very system that's meant to protect the body from infections. Hodgkin lymphoma is an eponym Latin combination. Thomas Hodgkin was a physician who did extensive research on this blood cancer, and so it was named after him. The term lymphoma is derived from the Latin words lympha, meaning water, and oma, meaning tumor. Hodgkin lymphoma often affects children ages 10 to 14, though the ages can vary. The first signs may be swollen lymph nodes in the neck, armpits, or groin. Mediastinal Hodgkin lymphoma is located in the lymph nodes within the chest cavity, so those are harder to detect. Either way, regardless of where the lymph nodes appear, Itchiness and unexplained fever are very common among people suffering from Hodgkin disease. When the lymphatic system can't function properly, impurities back up in the body, so it's not uncommon for the kidney and liver to go into overdrive. Every now and again, people who have Hodgkin lymphoma also experience acute kidney disease or acute kidney failure until the Hodgkin lymphoma has been resolved. Who to see? Well, the experts on lymphomas and other cancers are oncologists. They study the cancer and make recommendations for treatment. They also have other team members involved in the diagnosis and treatment process. Surgeons perform biopsies to see if the tumors are benign or malignant and later on remove those tumors depending on their location and size. And radiologists use radiographic imaging like X-rays, CT scans, and PET scans to assist the oncologist in staging the cancer. So there are a number of steps in getting diagnosed. Most people see a family doctor because they have these bizarre symptoms, itchiness, night sweats from being overheated, larger lymph nodes than just what you might get from a common cold or ear infection. So they'll generally see the family doctor, and once they've explored symptoms and eliminated other things, they'll be sent on to an oncologist and be recommended for a biopsy. When biopsies of tumors come back positive for lymphoma, the next step in diagnosis is to use radiographic imaging to clearly see the location, size, and relation of tumors to vital organs. CT and PET scan is the normal way to go because they provide the most accurate imaging for the oncologist for staging and treatment purposes. Depending on the size and location, the tumors may be removed. Either way, most patients fighting Hodgkin disease will require chemotherapy or radiation therapy to destroy all the cancer and reduce the chances of it coming back later on. The female reproductive system. The female reproductive system is discussed in Chapter 8. Many conditions that affect the female reproductive system can be treated. However, some of those conditions could render the female sterile if they're not treated soon enough. That's because bacteria can make their way through the reproductive system and damage important tissues, or certain cancers can spread so rapidly that the entire reproductive system or vital portions of it have to be removed. Cervical cancer is one such disease. It's not always easy to detect, and it's often fatal in later stages, so early detection is key. Cervical cancer is highly preventable. Females should begin getting pap smears around the age of 18 to track for abnormalities around the cervix. The test checks for the human papillomavirus. Vaccination with the HPV vaccine can be done much earlier than 18. Healthcare experts actually recommend that the HPV vaccine is given to both boys and girls between 10 and 16 so that they can prevent exposure to and prevent spreading HPV once they've become sexually active. Having HPV puts females at even greater risk for cervical cancer than the general public, and smoking compounds at risk. The term cervical cancer is derived from Latin, and it transliterates into cancer pertaining to the cervix. According to a U.S. government study done in 2014, younger women usually survive cervical cancers. Why is that? Well, in my own personal reflecting on this topic, I thought that, as a young woman, myself and my friends, whether we have children or not, our bodies are more resilient to certain infections, and since we're younger, we may bounce back from the harsh treatments involved in treating cancer like chemotherapy or radiation therapy. And also, because we're younger, we may not have children and we aren't grandparents yet, so the need to put a large amount of other people before us and before our health isn't as high, it's a lot easier to forget to listen to your body and to remember to go to the doctor when you have more family obligations and you're deep in your career, things like that. So just some personal reflection there. So those who suspect they may have something going on that's as serious as cervical cancer will probably begin by seeing their general practitioner for those complaints. But women usually find out that there's something wrong below when they go to a gynecologist for a routine checkup for those pap smears. If the gynecologist believes that there's something to be concerned about, then they will recommend that the woman begin seeing an oncologist and go from there. Symptoms of cervical cancer might be painful intercourse, changes to the menstrual flow or vaginal discharge, as well as weight loss and fatigue. Often there are no symptoms of cervical cancer, so many women are urged to see an oncologist during a routine checkup as soon as the gynecologist thinks that they see something abnormal. Diagnosis of suspicious looking growths on or near the cervix are done through a colposcopy or vaginal exam. This involves the gynecologist using tools to widen the vaginal walls well enough to clearly see into the vagina and look at the cervix with a special lens called a colposcope. Iodine is placed on the cervix to make abnormal areas more noticeable. Then a sample is snipped away from that area and passed on to pathology so they can make a call about whether those growths are cancerous or not. Treatment for cervical cancer involves a surgical removal of the tumor as well as effective reproductive organs, just depending on how much the cancer has or has not spread. Sometimes chemotherapy is required, sometimes it isn't. The male reproductive system. So Chapter 7 covers this portion. Chapter 7 also discusses STIs or STDs. Now, of course, anyone can get an STI or STD, but a lot of them are preventable by male partners using condoms or other barrier methods. Chlamydia is a sexually transmitted infection caused by the bacterium Chlamydia trachomatis. It can appear in the throat, eyes, skin, and of course, sexual organs of all genders and people of all sexual orientations. The term chlamydia comes from the Greek word chlamys, which means cloak or covering, and em means diseased state. Perhaps this name was chosen because it speaks to the very nature of chlamydia. Chlamydia is often referred to as a hidden or silent STD because there are no symptoms until the infection has actually made its way deep into the reproductive system for both males and females. About 1/3 of couples struggling with infertility include a partner who had complications from chlamydia or a similar STD and just didn't catch it in time, unfortunately. Depicted are the scientific and true-to-life examples of chlamydia's infamous symptom, a milky discharge. So that discharge comes from the urethra in males or the cervix in females. Most people see a general practitioner if they have concerns about an STD. You may see a general practitioner during a routine checkup. There usually are no symptoms, so those regular screenings are important. The diagnosis is made by swabbing the urethra, cervix, or anus, and also following up with a urine sample. If the results come back positive, then the patient is simply given an antibiotic for themselves, as well as one to give to their partner, or they're told to have their partner come in for treatment so that they can avoid passing the STI back and forth. The last portion of the presentation is dedicated to genetics and neonatology. as explored in Chapter 9. Down syndrome is a genetic disorder, and there are actually 3 different types of Down syndrome. There's translocation, masochism, and standard trisomy 21. About 95% of cases are standard trisomy 21 classified. Down syndrome is an eponym Greek combination. The term syndrome comes from the Greek words son and dramen. Son means together. Dramen means to run. This literally means to run together. It was selected because certain symptoms that run or occur together are classified as various syndromes or conditions. John Langdon Down was the first to classify the common features of people affected by Down syndrome, so this particular syndrome was named after him. So about 1 in 691 babies born in the U.S. are born with Down syndrome. The medical field has made so much headway in how we treat and suspect Down syndrome so that parents, families, and community members can prepare and educate themselves and each other about this syndrome. And the life expectancy for people who experience Down syndrome has actually done more than double in just about the past 30 years alone. So that's great news for people who experience it as well as their loved ones. People involved in diagnosing and managing Down syndrome are usually obstetricians, pediatricians, and general practitioners. The symptoms include unique facial appearance in the eyes, mouth, and ears, intellectual and developmental delays, and thyroid and heart disease are not uncommon. There are diagnostic tests out there that can be done in the 2nd and 3rd trimester of the mother's pregnancy, but those really aren't always accurate. When the baby is born, or actually even a few months after diagnosis, is the better time for the doctor to make a more accurate diagnosis of Down syndrome. There is no cure, but with self-care for the child and parents, Down syndrome and handling that often saddening diagnosis at first can be done with a lot more ease. Early connection with the community and with school teachers to create plans for optimum success and peer interaction are important and will allow the child to have the most engaging and fulfilling experience in school and into adulthood as possible. So thank you so much for your kind attention, and I hope